And you know what it was?
What was it?
Pass and race.
Oh no, really? Oh my
I
goodness.
messed that pass up so bad. I'm like, oh my God, I was
Yep.
weird.
Rescue alarm, confine, extinguish, pull, aim, squeeze, sweep. Don't ever forget it.
And every night I go to bed from that day on, I have to say that over and over right here.
You have to learn it.
I be at work and be stumped. I'm like, I forgot what race means. I'm sitting here panicking to myself. The craziest thing.
Okay, so just going over this really quick.
Okay.
We talked about hypophysectomy. Hypophysectomy is when you elevate the head of the bed to prevent increased ICP.
How you spell it?
HYPO, PHYSECTOMY.
HYPO.
Uh-huh.
H.
HYPO, PHYSECTOMY. And that's hypophysectomy. And we're going to elevate the head of the bed to prevent increased intracranial pressure. To prevent increased intracranial pressure. You have thyroidectomy, which we said we place the client in what position?
90.
Semi-fowlers to fowlers. To reduce. What are we reducing? For a thyroidectomy.
I'm not choking the blood.
To reduce the swelling in the neck area. Gastrointestinal hemorrhoidectomy. Hemorrhoidectomy. You want to assist the client to the lateral position to prevent pain and bleeding. For a hemorrhoidectomy, assist them to the lateral position to prevent pain and bleeding. Gastroesophageal reflux disease, also known as Gerd. Reverse Trendelenburg. Why do we do reverse Trendelenburg? Reverse Trendelenburg.
Head up, feet down.
Why? To promote gastric emptying. We do that to promote gastric emptying. Okay. Then we want to talk about liver biopsy. After the patient has a liver biopsy, what position do you want to place them in post liver biopsy?
After they have surgery.
What side? Left? Where's your liver?
I'm not sure.
Right upper quadrant. Right upper quadrant. So you want to place them on the right side. Right lateral position.
I used to know it.
Okay. Paracentesis. Paracentesis procedure. The client is positioned in semi-fowlers or sitting upright on the side of the bed or in the chair with the feet supported. Nasal gastric tube. For insertion, how we position the client that's getting a nasal gastric tube inserted. Yep. High fowlers, head tilted forward. We do that so that we can close the trachea and open the esophagus. For nasal gastric irrigations and tube feedings, you want to elevate the head of the bed to prevent aspiration, of course. And you want to maintain head elevation for 30 minutes to an hour after the intermittent feeding. Okay. Rectal enema and irrigations. What position do we place the patient in for rectal enema and irrigations? Left Sims, yep. Left Sims position to allow the solution to flow by gravity in the natural direction of the colon. Sangston Blakemore in Minnesota tubes. Sangston, Sengstaken, Blakemore. These are very uncomfortable for the client and can cause a lot of complications. But if they are prescribed, you want to maintain head elevation because you want to enhance lung expansion and reduce portal blood flow. Yep, put the head up, yep. Maintain the head elevation to enhance lung expansion. What do we use Sangston Blakemore's for? Not necessarily. They are used for the treatment of esophageal varices. Respiratory. COPD patients. In the advanced disease, you want to place the client in a sitting position leaning forward with the client's arms over several pillows or over the bed table. Lets the client easier to breathe. It's the orthopnic position. Radical neck. For a radical neck dissection, these clients are placed in semi-Fowler's or Fowler's position to maintain a patent airway and minimize edema. Maintain airway patency and minimize edema. Airway patency and minimize edema. Bronchoscopy procedures. You want to put the client in semi-Fowler's position to prevent choking or aspiration. Thoracentesis. You want to facilitate the removal of the fluid from the pleural space. So you want to sit the client on the edge of the bed and have them lean over the bedside table with the feet up on a stool. Abdominal aneurysm. Head of the bed 45 degrees to avoid flexion of the graft.
Head of bed 45 degrees to elevate.
To avoid flexion of the graft. How do you position a client first 24 hours post lower extremity amputation?
Elevate the limb. 45 degrees.
Are they supine or pronated?
Supine.
Pronated. On your stomach. Cup of soup, pour it out. You lay them on the stomach. And this is because they want to reduce the risk of flexion contractures.
And this is
Post amputation of the lower extremity. Cardiac catheterization. Bed rest 4 to 6 hours. Keep the extremity straight. Elevate head of the bed no more than 30 degrees. What do you want to prevent with cardiac cath? What complication? Bleeding. The patient with peripheral arterial disease, how do you want to position the legs? Do you want to elevate them, or do you want to keep them below the level of the heart?
elevate.
You dangle arteries, you elevate veins. It's an acronym for it, D-A-V-E, Dave. Dangle arteries, veins, elevate. If the extremity is red and edematous and painful in the DVT, bed rest with leg elevation is initiated. Patients with DVT, bed rest with leg elevation. Do we encourage frequent ambulation with a DVT patient?
Always say yes.
Well,
Move.
you want them to move if they have a clot?
No.
Right. That's what a DVT is.
We'll travel.
It will travel. It will go from a thrombosis to an embolus. We don't want those problems. Varicose veins. We would advise the client to minimize prolonged standing or sitting. Actually, they'll be on. You have YouTube?
Yeah.
Go on there. Yep. Venous insufficiency and leg ulcers. How do we position them?
Elevate.
Cataract surgery. How do you position the client post-cataract?
Are we talking about one eye or both eyes?
One eye.
Left or right? It doesn't matter?
If they had on the right side, you would position them on what side? Right. So the objective is just to say non-operative side to prevent the development of edema. Retinal detachment. If the detachment is large, bed rest and bilateral eye patching may be prescribed to minimize eye movement and prevent further detachment. So if they have retinal detachment in the right eye, they may patch both eyes just to minimize eye movement. What is the process called when you're doing your head-to-toe assessment and you and you are checking for pupillary reflexes in the right eye and the left eye response? What is that called? Assessing pupillary reflex in the right eye, and we have a left eye response. Consensual response. Consensual response.
I've had the hardest time to go to second from the head to toe. I would never forget.
Yep, consensual response.
That's when the left eye is moving, when you deal with the right.
Well, when you're assessing one eye and the other eye response. It's called consensual response. When caring for the patient with autonomic dysreflexia, how do you position the patient? Elevate the head of the bed, high fowlers. To assist with what? Ventilation and prevention of a hypertensive stroke. Caring for the patient with a cerebral aneurysm. Bed rest is maintained with the head of the bed elevated 30 to 45 degrees. You do that to prevent the pressure to the aneurysm site. How do you position the patient with a hemorrhagic stroke? Hemorrhagic stroke. Hemorrhagic means bleeding. You know, you have a hemorrhagic and you have ischemic. There's different ways you need to position the patient. If they had a hemorrhagic stroke, you want the head of the bed at 30 degrees to reduce the intracranial pressure. So with the hemorrhagic, H stands for head, head up. Ischemic, you want them to be flat. I learned that back in my LPN program. Yep. Oh no, that I was outdated one. No, I went to Brown Mackie in Ohio.
Oh, okay.
Yeah.
Okay.
Laminectomy. Laminectomy. That's back surgery. Log roll the client. Increase intracranial pressure. Head midline. Elevate 30 to 45 degrees.
30 to 30?
30 to 45. Avoid extreme hip and neck flexion. Okay. Total hip. Position depends on the surgical techniques, anterior posterior approach. You want to avoid extreme internal and external rotation. You want to maintain abduction. Abduction. They have abductor pillows that you can put in position.
So it's
Abduction. Yep. AB. Do not cross the hips. Cross the legs, rather. Do not cross the legs.